All right, let's talk about inguinal hernia surgery. I know, it might sound a little intimidating, right? But stick with me, because by the end of this, I promise we're going to break it all down step by step so it makes perfect sense. Ready? Let's dive in. And yeah, let's just start with this. Don't worry, this stuff is actually pretty straightforward once you see how all the pieces fit together. It's not about memorizing complex terms, it's about understanding the logic. And that's exactly what we're going to do. So here's our game plan. We're going to make this whole thing simple by looking at the three main types of hernia operations. The trick is we're going to start with the most basic one and then just add layers, like building blocks. It's the best way to really get it. Okay, so where do we even begin? We start at the foundation, the absolute ground floor of hernia repair, the herniotomy. So what in the world is a herniotomy? A herniotomy is, hands down, the simplest of all these surgeries. Now, the key thing to lock in your brain is who it's for, and that's mainly infants and children. And its goal? It's laser focused. All we're doing here is removing the hernial sac. That's it. Nothing more. Okay, so let's get into the nitty-gritty of the procedure itself. We're going to walk through that foundational first step we just talked about, the herniotomy. So how does it all go down? Well, first, the surgeon makes the skin incision. Then they carefully open up the fascia layers. You can kind of think of these as the body's internal wrapping paper. Next, they divide the external oblique aponeurosis, which is just a fancy name for a strong, flat tendon, to get to the area they need to. From there, they isolate that hernial sac, tie off its neck, and then they just excise it, remove it. It's a very precise, very clean process. And this is the most crucial point to remember about a herniotomy. There is absolutely no repair of the inguinal canal itself. Zero. It is all about just getting rid of that sac. This works so well for infants and kids because their muscles are strong and still developing, so their body will basically take care of the rest once that sac is gone. All right, so we've got the herniotomy down. Check. Now let's add the next layer to our understanding. What happens if just taking out the sac isn't going to be enough, especially for an adult? Well, that's where suture repair comes into play. This brings us to our next procedure, herniorrhaphy. And the best way to think about it is like a simple math equation. A herniorrhaphy is just a herniotomy, which we now know all about, plus a repair of the posterior wall of the inguinal canal. See, we're literally just adding one extra step. So, what does this repair actually look like? Well, the surgeon goes in behind the spermatic cord and carefully stitches the conjoint tendon to the inguinal ligament. What they're doing is directly reinforcing that weak back wall. And to make sure it holds up, they use really strong permanent sutures like Prolene. Ooh, and fun fact, this classic technique is also known as a Bassini's repair. But what if you need something even stronger? A more durable, heavy-duty repair? Well, that brings us to our final procedure. You can think of this one as the strongest shield in the world of hernia surgery, the hernioplasty. You guessed it, let's go back to our building block formula. A hernioplasty is a herniotomy plus a herniorrhaphy plus the addition of a mesh. This mesh is a total game changer. It acts kind of like scaffolding or rebar in concrete, providing this powerful, tension-free reinforcement for that weakened area. And what is this mesh actually made of? Well, there are two main options. You've got autologous materials, which is tissue taken from the patient's own body. But what's way more common today is heterologous material. This is a synthetic material, and you've probably heard of Prolene mesh. That's the one that's most widely used. This stuff provides incredible, durable strength. And that strength? That's the whole point. Because of this mesh reinforcement, hernioplasty is the strongest repair with the lowest rate of recurrence, meaning the hernia is much less likely to come back. And that's exactly why it has become the gold standard for most adults who need this surgery. Okay, we've covered all three main types of repair, building our way up from the simple to the complex. So now let's put it all together and see how a surgeon actually decides which one to use for a patient. This table really sums it all up perfectly. For children and infants, all you need is that simple herniotomy. Just remove the sac. For adults, you absolutely have to repair that weak posterior wall, so you're going to be choosing between a herniotomy or a hernioplasty. But for the strongest, most durable result, the hernioplasty with its tension-free mesh is the modern standard for adults for sure. And really, that's the main takeaway here. It's all about matching the surgery to the patient's specific needs. For kids, you just need a simple sac removal. For adults, you need a reinforced structural repair to prevent that hernia from ever coming back. It's all about choosing the right tool